Thanks for joining us for HME TV. I'm Jennifer Kern. I'm a contributing editor for HME News. And today we have with us Michelle Gunn. She's president of NRRTS. And we're going to talk about complex rehab and where things stand as far as carving out a separate benefit for complex rehab. And you've had quite a lot of activity on the Hill. When you go, I want to talk about outcomes first. When you go on Capitol Hill and they ask you why is complex rehab so important, what are some of the outcomes that you share with them?
Well, I think this will be the fifth or sixth year that we're having our SELA event, and that's where we're going to the Hill. And it's kind of been an evolution of watching them actually understand what it is that we do. And we kind of go to the Hill with, first it was mostly anecdotal stories, taking individual case studies and going in and showing them, I had one that I wrote up for our magazine Directions, where I had a client who was a fairly involved girl with CP, and she just went into any old HME and ended up in a Group 2 power chair with a captain's seat. And, we'd like to not think that people are doing that out of, ill will. It's maybe just not having the experience. And so what I had done is I did a seminar presentation on her, and we ended up getting her in a Group 3 with a rehab seat and customized seating. And during the presentation, I was able to snap pictures of the before and the after case study. And when I started going on the Hill and I would take those pictures, when you talk to your representatives and I'm saying, you're going to pay for the equipment. Do you want to pay for this one, or do you want to pay for this one and know that this one is the one that's going to not cause her any harm, be more expensive in further surgeries and different things like that. So really trying to show to them that there's a good reason they're here, that we're here, and that they really are going to be better off with us than they are without us.
And you take patients with you onto the Hill
we
too,
do.
Don't you?
We've been able to take, I think last year we took up to 20, and we work real hard before we go getting sponsorship money and scholarship money to get them there, and that's quite an event in itself.
And I'm sure it makes a big impact.
A big
on
impact.
The people you meet with.
Well, and it's funny when we go, you might get an appointment with a legislative aide or somebody like that, but as soon as you have a consumer with you, a lot of times you would actually get the person you were trying to see would change their schedule and actually show up to the meeting. So, having the consumers there, they're the voice. It definitely changes the game.
So you bring along with you anecdotal data, you bring along with you patients and case studies and people who can say, wow, this is how my life has changed as a result of what the complex rehab provider has done for me. But I understand now you're going to have some actual statistics to back that up.
I believe we will when we go this time. NRRTS has partnered with the University of Pittsburgh. We're involved in a 6-month pilot program where we're studying outcomes. It's a little young into the program. We've only been doing it for about 4 months now, and we finally got to see some of the data and its analysis and showing the different charts and things like that. It's very young. It's still a fairly small sample group, and at this point that data isn't published. So we're hoping that we continue that program and that we'll be able to actually take it with us when we go this year and say, what we've always been saying is true, is that we really are making these changes. And then hopefully once you see these positive outcomes, that you'll also see the savings on the other side. And that's, whenever you go and they talk about, okay, if I do this for you, if you get the separate benefit category, and now we just finally got the scoring, so we know kind of what we're talking about, they're always asking, well, what's the pay for? And we can't, as an industry at this point, give anything back. We can't take another cut. We aren't going to be able to provide the products and the services that we need to do to get the job done. But what we can show is that if you pay for this now, you're going to have all this savings on the cost of that person's care on the other side.
Well, so tell me about this effort to carve out a separate benefit for complex rehab. If that were to go through, what do you think the impact would be on patients, on providers, on physicians? Where will the benefit go among all those stakeholders?
Well, I think it's probably going to be equal everywhere. Right now, with the policies and being lumped into, the DME benefit, I think a lot of the funding sources, and not just CMS, but they set the tone for everybody else. When they think it's just a walker or a wheelchair or a hospital bed, that why can't somebody just drop it off and set it up? And being able to show them, the complex rehab, that it takes somebody to go out and do an initial eval, and then to probably come back with a demo piece of equipment.
That's called complex for a reason.
Exactly, exactly. And if they don't have those pieces of that puzzle, you're going to do it wrong, and you're going to cause people harm.
Thanks very much, Michelle, for being with us.
You're welcome so much.
And thank you for joining us for HME TV, and we'll see you next time.